Hi everyone, I did my case scenario on a girl named Naya and I entitled it Naya and the Way to Transition. For specifics on my case scenario, I did my presentation on Naya, who is a 15-year-old African American female living in an urban North Carolina community. She was recently placed in a kinship foster care placement with her maternal aunt after her mother was hospitalized for untreated borderline personality disorder. Naya has begun skipping school and activities, withdrawing from peers and friends, and showing signs of depressive symptoms such as fatigue, irritability, and sleep disturbances. Naya's school social worker has also noticed a decline in her grades and potential sexual promiscuity due to her new peer group. If you look at some relevant history and context related to Naya and her situation, you need to look at her family dynamics, her socioeconomic status, her trauma history, and systematic and environmental factors. Starting with family dynamics, it's important to know that Naya grew up in a single-parent household where her mother worked 3 jobs, but at the same time struggled to maintain consistent mental health care. Naya often served as her younger sibling's caretaker, and this was also due to the fact they have a low socioeconomic status, which meant they couldn't really afford to pay for daycare or have a nanny. Naya's family also has a history of food insecurity and housing instability despite living in an urban community. So trauma history, Naya definitely has experienced multiple adverse childhood experiences, which include exposure to community violence, parental mental illness, and domestic violence between relatives. As far as systemic and environmental factors, there are limited resource schools in her neighborhood. She also has limited access to responsive mental health services, and there are also racial disparities in juvenile justice and school discipline systems. The key stakeholders in this scenario are Naya, her maternal aunt, her school social worker, a therapist, caseworker, and the teachers and school administrators. Now, looking at the application of evidence-informed practice, it's important to know that evidence-informed practice is the integration of the best available research, clinical expertise, and client preferences and values in making practice decisions. Evidence-informed practice expands upon evidence-based practice by acknowledging the importance of cultural context, practice wisdom, client voice, and community-based knowledge. When we look at practice-informed research in this case, it's important to know that practice-informed research refers to how frontline practice experiences influence the kind of research questions generated and how researchers refine interventions based on real-world needs. And both EIP and practice-informed research are essential to social work in many ways, but also because they promote accountability, improve client outcomes, reduce harm caused by bias or culturally inappropriate interventions, and they also bridge the gap between theory and reality. Now, for my social work theory that I chose to look through as a lens for this scenario, I chose the person and environment perspective. This perspective believes that individuals are deeply shaped by their social, environmental, and systemic context. For Naya, this means that depression symptoms cannot be understood without considering her parental mental illness, the academic stress she is placed under, the community violence she may witness or be a part of, structural racism she experiences, and economic instability. The PI perspective is widely used in child welfare and adolescent mental health settings because it helps practitioners integrate ecological factors into intervention planning. And research shows that adolescents' mental health outcomes improve when interventions address both individual symptoms and environmental risk factors. For my evidence-informed intervention topic or method, you may call it, would be trauma-focused cognitive behavioral therapy. Trauma-focused cognitive behavioral therapy is a structured, short-term treatment designed to address trauma-related emotional and behavioral difficulties in youth. The core components of this kind of therapy are not limited to, but include psychoeducation, coping skill development, gradual exposure, trauma narrative processing, and caregiver involvement. The objectives of this kind of behavioral therapy include to reduce trauma-related symptoms, improved emotional regulation, strengthen family communication, and rebuild a sense of safety. TFCBT is one of the most validated treatments for trauma in children and adolescents, and research shows that a significant reductions in PTSD symptoms among diverse youth, including African American adolescents. It also has improved caregiver-child relationships, and it has effectiveness across foster care, community mental health settings, and schools. And I will like to quickly mention that my workplace, which is Behavioral Health Hospital, uses TFCBT as one of their treatment methods, and I have seen firsthand how this has helped people. I know that could be seen as from a biased point of view since I work there, but I've also looked at the research from my hospital, and I've seen that the numbers do back that statement up. As far as implementing this, there are 5 steps that I think are important to consider, which is assessment, engagement, implementing the practice components, coordinating with school and caseworkers, and monitoring NIA's progress. First, for assessment, you need to conduct a biophysical evaluation, basically screening for trauma, exposure, and depression. For engagement, you need to build rapport with Naya and involve her aunt as a supportive caregiver as much as you can. You need to implement the practice components, which are psychoeducation, relaxation, affective regulation, cognitive coping, trauma narrative, in vivo mastery, conjoint sessions, and enhancing safety. You need to coordinate with school and caseworkers, which includes integrating academic support and safety planning on that level. That way she can safely go to school and feel supported while trying to achieve academic greatness. It's also important to monitor progress and using validated measures like the PHQ-A scale and also the Child PTSD Symptom Scale. There are some challenges to this and also some strategies that come about in this. For potential challenges, there's still a lot of stigma around mental health in African American communities. There's also low engagement due to school avoidance, because if Naya is not going to school, you can't really involve the school counselor or the school social worker to an extent, because she's not going to have contact with that person in the normal way you would. Also, it's important to remember that the caregiver stress and kinship placement can also play a huge factor, because you don't know if the caregivers in any kind of situation that take on these kind of placements have other kids or money problems themselves, but they take on these placements and have to support more people, or just don't have the mental capacity to deal with all this stress. Some strategies you could use to help with this is utilizing school-based sessions to reduce barriers, use culturally responsive engagement approaches, offering caregiver support groups, and also adjusting the pace of trauma narrative work as needed. If there's one topic that you could see that is really bothering Naya, such as her mom's challenges with mental health illness or even possible sexual promiscuity, you might need to focus a little bit more on that than you would maybe her not wanting to go to class. Even though it's an important topic, some things have a little bit more weight to them than others. There are some ethical considerations you need to look at when looking at this case. These include informed consent and consent and assent. Sorry, I combined the two. Confidentiality, power dynamics, and cultural competence in anti-racist practice. When talking about the informed consent and assent, confidentiality and cultural competence, anti-racist practice, and power dynamics, when talking about informed consent and assent, we need to ensure that Naya and her aunt understand treatment goals and confidentiality limits. We also need to use youth-friendly language. For confidentiality reasons, we need to balance Naya's right to privacy with the mandated reporting status that social workers and health professionals have. We need to also be sensitive to topics such as possible gang involvement, trauma, and anything sexual, and we must know that these must be handled carefully. When we think about power dynamics, we must maintain transparency to reduce mistrust of systems that have historically harmed African American families, and we need to engage Naya in a shared decision making to strengthen autonomy. We also need to address systemic racism directly through and in intervention planning. We also need to incorporate culturally rooted coping strategies such as family strengths, music, and spirituality to help with the treatment. And we also must be an advocate and also advocate against school disciplinary practices that disproportionately affect Black male students and Black female students. For my critical reflection, analyzing Naya's case through an EIP lens highlights how research, practice wisdom, and client voice must be integrated to form effective interventions. Through Naya's case, I learned that EIP requires openness to multiple forms of evidence, cultural humility, which is an essential component of social work practice, and it also requires a commitment to anti-oppressive practice. This case also illustrates the complexity of real-world practice. Clients are shaped by multiple factors that require flexibility and flexible, responsive approaches, and we must keep that in mind. I'm left asking myself many questions after this case analysis, but one's also, how can we best advocate within schools and child welfare systems to reduce disparities? Within thinking of that, I think you have to obviously know the population that you're working with. You often will have to do research about your area if you don't know certain things about it, but I think you should also keep an open mind and take feedback from the clients, and in this case, the children you're working for or working with. For my references, I use these. And thank you for listening to my presentation. My name is Victoria Shove, and I've included both of my emails there if you need to contact me or if you have any questions.